Good morning. I am Dr. Sreekanth Appasani, Medical Gastroenterologist, KIMS Hospital. Today we will be discussing about a very common problem, constipation. Constipation itself is a symptom. It is basically that you do not pass the stool adequately. Now, adequately has got a variable definition. For some people, even if they pass once in a day, that is probably not sufficient. For some people, even if you pass once in 3 days, that should be okay for them. So, as per our medical criteria, constipation has got a definition. They say that if you are not able to pass stools at least once in 3 days, you call it as constipation. If you are straining for more amount of time, at least 3 times in a week, probably that is constipation. And if you are having exaggerated pain or some other symptoms related to the bowel passage, even if you are passing it daily, probably that's also called constipation. The fourth important thing is the consistency of the stool. So we have a scale which is known as Bristol stool scale, where grades 5 and 6 are very hard stools, which we call it as constipation. But in general colloquial terms, if you are passing hard rock like stools, probably that is constipation. So for a layman, if you are not passing stools to your satisfaction, or if you are passing hard rock like stools, or if you are straining too much, that is you are taking too much of time in the washroom to pass the stool, or you are having some symptoms developed because of this abnormal stool passage, probably that is called constipation. Risk factors for constipation are by and large diet and lifestyle related. Constipation is a diet and lifestyle related issue. What is a stool? It is a product which comes out after the food gets digested and the undigested food becomes the stool. So it all depends upon what you eat. If you eat less of fiber, less of water content is there in your diet, probably it leads to constipation. So that is the first and foremost important factor, diet. So fiber in the diet, amount of roughage which we take like fruit, salads, green leaf vegetables and all, if that content is reduced, more amount of refined foods are there, that leads to constipation. The second thing is water intake. You need to take at least 2 to 3 liters of water a day normally, because if you don't take adequate amount of water, the body has got no other option. It has to take back the water which is going out from the motion. So it will try to absorb the motion related water and your motion becomes hard because it is deprived of water. So if you don't take adequate amount of water, the body will take back the water from the stool and make it hard, and that's why constipation happens in these. These are the common reasons, but there can be diseases also like colon tumors, colon cancers, colon motility, that is movement of the intestine being wrong, diverticulosis, where the intestine becomes having pouches outside the intestinal wall, or sometimes because of recurrent infections, some abnormal movements being restricted, some abnormal adhesions being developed. These are the common reasons why people have constipation apart from diet and lifestyle related issues. And the last and final reason is the patient has got a nice motion passage, the patient has got a nice stool formation, adequate amount of stool reaches the intestine, but you are not able to push it out, because the art of pushing out, which we actually do involuntarily, we don't actually think about passing the stool, we just go and sit on the commode and then it automatically comes out. Whereas this has got a nice coordinated movement, that is there is an internal sphincter, external sphincter and the rectum. So when the rectum presses out, the internal sphincter relaxes, whereas external sphincter does not relax. The external sphincter will see whether you are in a socially acceptable condition. Only if you are in the washroom, it will let it out. If you are not near the washroom, it will still keep closed and the body becomes silent. Now, once you are in the washroom, the rectum contracts, internal relaxes, and also it knows, the external sphincter knows you are in a socially acceptable scenario. It also opens up. Then the stool comes out. If these three things don't happen in a coordinated way, it can also cause constipation. We call it as pelvic floor dyssynergia. where the patient's movements are not regulated and they're not working in a coordinated fashion and start developing constipation, because the rectum might be pushing from above, sphincter is not opening up, and that's where they develop constipation. Constipation doesn't need any special investigations to diagnose. It only needs a proper history taken from the patient and the type of food items which the patient is taking. But to know why the patient develops this constipation, we need appropriate investigations. Example, if there is a colon cancer, colon tumor, there is some narrowing in the intestine which has obstructed the passage, we need colonoscopy. Sometimes, as I told you, pelvic floor descent, where the movement of the intestine doesn't happen properly, it's not coordinated, we need anorectal manometry to diagnose these things. But the important factor which we should not ignore is the other conditions which can cause constipation. Like for example, commonly thyroid problems, hypothyroidism, diabetes uncontrolled can cause constipation. So we need to check the thyroid levels, we need to check the sugar levels to see whether that diseases are there which are contributing to constipation. And routine investigation like hemoglobin and all also need to be checked to see whether these things are lower or normal, so that we can investigate further from this constipation point of view. Very rarely we require motility studies, that is movement of the intestine studies, to see whether the colon is moving appropriately or not. That's the next level of investigation done in refractory cases of constipation. So as I told you, since constipation is a disease of diet and lifestyle, we need to change the diet and lifestyle. The first treatment which I suggest to my all patients of constipation is diet and lifestyle modification, because if you are going to give you some medicines, they will work temporarily. Once you stop the medicine, this constipation is going to hit you back. So unless you change your diet and lifestyle, the constipation does not improve with simple medications. So what do you need to do in diet and lifestyle modifications? One, increase the amount of roughage, fiber in the diet, fruits, salads, green leafy vegetables, kheera, carrots, etc. All these fiber rich items should be increased in quantity. For example, if you are already taking some amount of fiber, increase the amount of fiber. See that you eat brown rice once in a week, eat oats once in a week as a breakfast. Try to increase the amount of salads in your meal. Make sure that salad is a part of your meal at least once in a day. The second thing is water intake. Make sure that you take at least 2 to 3 liters of water a day. The problem here is that we all think that we take adequate amount of water, but we may not be taking. So unless you measure it, you do not know. So always try to drink from the same bottle which you are drinking every day, so that you have a gauge of how much you are taking. You take 1 liter bottle, fill it, you continue to drink it. After the end of the 1 liter bottle being empty, you know that you have consumed 1 liter. You have 2 more liters to take in a day. So like that, you keep a watch on how much you are taking. At least 2 to 3 liters of water is a good intake that will prevent constipation. The third thing is then correcting the secondary problems like diabetes, thyroid, other medical problems, whatever, they should be under proper control for your constipation to improve. Lastly, we start off with our medications. We have different types of medicines. We have stimulant laxatives, we have osmotic laxatives, etc., where we give polyethylene glycol, we give lactulose, we give picosulfates, etc., which help in either improving the motility of the intestine, helps in pushing the stool outside, or it drags a lot of water so that the stool becomes liquidy and then comes out. So these are different types of medications, either in the form of tablets, syrups, etc., which will help in pushing the stool out. And lastly, we have some fiber supplementations along with your natural fiber which you are taking. We give you some fiber supplementation also, so that until your lifestyle changes, that is your dietary habit changes, because even if I ask you to eat fruits today, your effect will be coming after 1 month or 2 months. So until that time, we can give you some artificial fiber so that it becomes a habit for you to take natural fiber, and we can supplement it with this artificial fiber until that time where your natural habit has taken over and provided the gut with adequate amount of roughage or fiber in the diet. Now, the last problem is the colon related issues. Suppose there is a narrowing, you have to open it up. There is a cancer, you have to remove it. There is a dysmotility happening around, that is pelvic floor dyssynergia. You give them training sessions where we call as using the anorectal manometry. We train these pelvic floor muscles by giving some exercises using a biofeedback mechanism, wherein the patient is trained how to relax the sphincters when there is a socially acceptable environment for defecation. So diet lifestyle modification, water intake, correcting the basic diseases like diabetes and thyroid issues, then correcting the colon diseases like cancers, etc. And in cases of in cases of pelvic floor dysfunction, have biofeedback mechanism to train the muscles to defecate properly. And lastly, body exercise is also important. Once your body moves, intestine also moves properly. So if you are having a sedentary lifestyle, eating and sitting from morning to evening, then probably your muscles in the intestine also become lazy and they don't move around. Your body has some regular exercise like walking and jogging, your intestine also moves. So if you have a regular healthy habit of having exercise at least 30 minutes a day, probably 3 to 4 times a week, probably constipation can also be avoided using this.